Hi, I'm Dr. Michael Marshall from Veterinary Wellness Center in Boise, Idaho, and today I'm going to talk about the canine influenza virus. So the canine influenza virus is a highly contagious respiratory pathogen, which basically means that it's a virus that affects the respiratory system in dogs. Now, it can be spread from dog to dog in a variety of ways, either through direct contact, possibly through aerosol transmission, which is either after a cough or sneeze, the virus is just basically flying through the air, or fomites, which are things like toys and food bowls that could transmit it as well. So about 2 to 4 days after your dog is exposed, they'll start showing the clinical signs. And then about 2 to 7 days after that, they can shed the virus. So it definitely can be shed for a while. Clinical signs may last up to 2 to 4 weeks. So what do we see? Well, in the mildest form, it may be subclinical, which means that your dog has it, it's probably shedding it, but not showing any clinical signs, to a moderate infection, where we'll see things like a mucopurulent nasal discharge. A cough is often common. It's a moist, productive cough. They're kind of hacking stuff up. To the most severe, which is where they have fever and they're lethargic and it's gone down to their lungs and they could have pneumonia. Now that can be certainly fatal, so it can be very serious. If you're seeing any signs, definitely check with your veterinarian. And what they'll do is they'll diagnose it through clinical signs. They may take an x-ray to check to see how the chest is doing. And then they will initiate treatment, which is antibiotics and supportive care. The antibiotics may go up to at least 4 weeks, depending on how severe the case is. Supportive care is things like hydration, fluid therapy, may institute some food therapy to make sure nutrition is staying up and supporting the body. The most important thing is to keep your dog protected, and that, of course, is through vaccine. So the vaccine out there is called bivalent because it hits two strains, which are the H3N2 and the H3N8. When your dog first gets the vaccine, they're going to need to have a booster about 3 weeks after that. And then the vaccine is annually. A lot of kennels out there, daycare, doggy daycares, do require the vaccine just because of that potential for the subclinical infection where they're actively shedding. But I think it's a great idea to have vaccinated. So check with your veterinarian. So that's basically the rundown. Thank you for watching. Please like us on Facebook at VWC Boise, and have a great day.